very warm welcome to all of you. We are here to discuss on a very important topic, and I'm Sayukta from Beautiful Spotless Skin team. So today our topic is acne management. Now, acne is such a chronic skin condition, and most of us have gone through that phase, during our teens of acne vulgaris. It's so common. But then it's important to understand what to do and more importantly, what not to do. Plus, those who have oily skin or acne-prone skin, or especially women, because with so much of environmental change, systemic changes going on, a lot of hormonal changes, disbalance takes place, and that's why we are equally prone to acne as an adult as well. So today we are going to talk about acne management. So we'll understand how to maintain a good skin quality by maintaining a good skincare routine, and how to treat. Then these scars and marks, they look like they are forever, ever and ever. So we will try to understand how to manage acne, and for that, as a skin expert, we are going to have Dr. Divya live from Chennai. So Dr. Divya is a highly experienced dermatologist and cosmetologist with over 16 years of experience in both clinical and cosmetic dermatology. She is the chief consultant at Radiance Clinics in Muggapur, East Chennai, and also consultant at Bilroth and Kumaran Hospitals. A graduate of Government Stanley Medical College, Dr. Divya completed her post-graduation training at Madras Medical College and earned an IADBL fellowship in cosmetology. Dr. Divya specializes in dermatology, laser treatments, vitiligo surgery, PRP therapy, and anti-aging procedures, etc. And here we go. We have with us Dr. Divya. Very warm welcome to you, Dr. Divya.
Thank you. A very good day to
So,
you
Doctor,
all.
Very good afternoon to you, Doctor. Today we are going to talk about acne management. And first of all, we will try to understand what is acne, why it happens.
Fine. First, I'm very thankful and I'm feeling blessed to have this interactive live session on acne management, because acne is one of the very common entities what we encounter in our daily OPDs, and it's such a rewarding kind of a diagnosis. Like if a teen comes to my clinic with acne, I'll be kind of happy because you will get a promising clinical outcome, and we are happy both from the doctor side as well as the patient side. So it feels so happy to talk about acne. Also that um, there are a lot of myths about acne. So I'm taking this as a great opportunity to clear all those myths on
Definitely, we'll
acne.
try to burst all the myths, around acne. So, yeah, doctor, to start with, what is acne? Why it
Yeah,
happens?
it is it's a chronic inflammatory condition. So it's an inflammatory condition of the skin. Unlike everyone feels like it's a hormonal condition or it's an infective condition. It need not be a infective disorder. It is something that is related to the activity of the pilosebaceous glands in our skin. Basically, the oil secreting glands. The
Uh-huh.
glands which secrete oil to give you that, to get rid of the dryness as well as the smoothness in your skin.
Mm.
It is basically an antifungal and antibacterial also. It's part of the defense system. When there is some kind of a disorder, which may be a hypersecretion, that is more oil secretion, and more secretion of the cells as well as the oil, which will tend to aggregate and block the pores that will let the oil out of the glands into your skin. That's one more thing. And it could be a bacterial infection also. And some influences like certain medicines or certain hormones, endocrinological disorders, application wise topical makeup or some kind of ingredients, active ingredients in your creams, where what we use day to day. If there is something that is not, that your skin is not accepting or that is clogging your pores, that could be a reason for your acne. So it is basically a pilosebaceous gland inflammatory condition.
Okay, doctor. Doctor, many times, as a layman, we see various stages or grades of acne. Initially, we see those, what we call whitehead, blackhead. then they are bigger, then they are more painful, pus-filled, and then we get those big cysts like acne. So, what are the various types or grades of acne, doctor?
Yes, that's a very good question. Basically, in understanding acne, it can present in various stages to you, like very initial stage or even very advanced stage. So we
Mm-hmm.
have four grades of acne, where initial presentation will be like smaller bumps or like pustules we call, no? So it will be presenting with just comedones, we call it comedonal acne. It is in the
Okay.
very beginning stage, or it will be that kind of an acne where you will see only comedones. Comedones are like blackheads or whiteheads. When the keratin plug or when the pilosebaceous gland is clogged with the secretion which is not opened, you will get whiteheads. And if it is
Mm.
opened and gets exposed to the open air, it gets oxidized to give you the black thing that we
Okay.
call blackheads. So that is
Blackheads.
comedonal acne, yeah. And in grade one of acne, we have only smaller papules, like what we call like prickly heat or smaller bumps.
Mm.
And if it is presenting with pustules that we call smaller white, I mean, quite big to
Mm.
see in your naked eye, that is pustules. We call it grade two. In grade three, you will have bigger, what we call, bigger bumps or even lumps, nodules, pustules will be there. That will go on or progress to get infected to become bigger lumps. We call it as abscess also, and they'll also present with multiple scarring because they would have had this repeatedly, and a few would have got scarred, and in that case they'll present with abscesses as well as scarring. That we call it
Oh.
as grade 4. Just grade 4 is kind of a severe acne. So on
Mm. Okay.
these various presentations will be there. We have to treat according to the presentation what you have.
Absolutely. And doctor, many times we get acne on foreheads, just on the forehead, small bumps, or in the butterfly areas, or many of us get acne alongside the jawline.
Yeah.
So do they tell us something? They symbolize us something?
It does. It does. Sometimes, generally, people have different types of skin, like dry skin, oily skin, or combination skin, where we have some zones in your face which is always oily, in spite of the different types of your skin. That we call as T zone, the forehead, the center part, nose up to the upper lip, or even the chin. This T zone is started with more oil secreting glands. So if the T zone is specifically involved, it could be the age-related acne or because of the seborrheic dump. It is what we call dandruff. So dandruff will aggravate or trigger acne. In that case, you will have that T-zonal acne, forehead and the center part over the nose and little bit around the nose. Okay, in some cases, they'll have just over the the center part of the face, involving the nose and the sides of the cheeks,
Yeah.
with some kind of redness. Those we need not be acne; it could be rosacea. It will look like acne, but it need not be acne. Some people will have additional hormonal issues where they, apart from having acne over the face, they'll have over the body also, truncal acne, and
Mm-hmm.
they'll have over the chest and the back and upper shoulders also. Some people will would have used some kind of a topical steroid, most commonly used for rewarding fairness, what they expect. The chronic use and overuse of steroids may give you an acne-like appearance where the presentation of the spots, the lesions we call. So it will be like almost everything will look very similar. There will be no comedones, no pustules. Everything will look very similar. That will be very evenly distributed over the face and trunk. That we call drug-induced acne, acneiform eruption. So it
Okay.
does give us a clue about what type of acne and what the cause could be.
Right. And after a very common problem in our society is that we are so obsessed with, home remedies or over-the-counter medication or DIYs because nowadays there are so many influencers of various social media platforms and most of them are not qualified dermats, but still they'll tell us how to take care of these acne. So we'll run inside the kitchen, apply something starting from toothpaste to garlic to this and that or we have this chemist shop so easily accessible, available everywhere. We'll go and get a something to apply on a topical application, what we call. How bad or how harmful these home remedies, DIYs, over-the-counter topical applications they can
Very
be?
expected and very commonly encountered question.
I'm sure.
Because people are very, sometimes they're very anxious about taking medications for acne. So in that case, we are on the lookout of something natural that will give us a cure. So first thing to be advised here is, if you're trying to use a natural ingredient, it may not give you an immediate cure, but it will definitely maintain your skin tone or the skin texture, whatever we are expecting. So in case when you're not at all doing any skincare and all of a sudden you get an acne and you're jumping into a uh, natural ingredient kind of treatment, then it may not be very rewarding. But still, in case of acne, apart from like regular skincare with natural ingredients, I'll be focusing today more on acne. So in that case, natural ingredients, what I would really suggest is something that is very milder, like something that is having lactic acid, like milk, curd, all these kind of milder ingredients are okay. And if you're using some veggie extracts or veggie juices like potato, cucumber, even
Mm.
tomato is fine. But apart from this, you can use this Bengal gram powder that can be mixed with curd or milk. All this is fine. But I would really suggest to avoid certain ingredients like honey, turmeric, lemon juice,
Okay.
certain juices, and orange peels, all those. When
Mm.
you are having an active acne, there is already the skin is inflamed and to
Right.
some extent, and you are trying to irritate your skin with these kind of sharper ingredients like citric acid, which when used without any dilution or when used directly on your skin can actually aggravate your acne. So it will tend to trigger your inflammation that may work otherwise on your skin. So in active acne specifically, I would suggest to avoid these kind of very stingy kind of things like turmeric, honey, which will actually irritate your skin in those conditions. When you're using it in your normal skin, and that too, if it is in a diluted form, it is absolutely acceptable. So go with milder ingredients like milk, curd, cucumber juices, um, and potato peels, potato juices also would be fine. Other things like garlic, when used when you're having pustules and all, is like
Toothpaste is
it will work.
also
Oh
very
my God.
common. Toothpaste
No,
application.
no, no. It will actually, it may you help you to get rid of the pustules or kind of inflammation at that point of time. But you may end up in serious post-inflammatory pigmentation after that episode. So I would
Right.
suggest not to use toothpaste and all. No way.
And
Better to avoid.
I'm sure people will agree with me. Treating acne is one thing. Treating post-acne inflammatory marks, pigmentation, and those big pits and scars, they look like the bigger challenge. So
That
please don't
it
take your
is a
acne to that
challenging
extent.
condition.
Yes, that is the thing. So, Doctor, also about those topical applications that we normally get from a chemist, nearby chemist, and start, applying. Initially, they work like magic. So we feel that, oh wow, we have saved the consultation fee of the mat and appointments, etc. And we have this magic cream in our hand, but then we
Exactly.
realize later that we are now an addict to it. So what's your, how would you like to address that?
Over the counter medications, like it without seeing the patients, when they are suggesting you a cream, that is absolutely not okay, because a lot of conditions will look similar but these may not be similar. Even when someone is presenting to me with papules or kind of bumps in the skin which may look red or white with pustules, it need not be acne. It could be rosacea. It could be a gram-negative folliculitis. It could be because of drug, or could be because of some cosmetic irritation, or simply could be a drug reaction. In those cases, even if you're presenting to me with just bumps on my skin, I feel it is acne. But with clear examination and clear history taking, what you have done to your skin, what has been taken, what is the associated condition, I have to rule out other condition apart from acne. Only after
Okay.
ruling out those conditions, I can prescribe you acne medications. So, treating like with the OTC over the counter products, I would really not recommend it. Also, the first thing when someone having an infection is to go get an ointment which would have a combination of topical steroid, antibacterial, antifungal combination. This is the common combination with what everyone is using. That is
Right.
one of the worst things to do, because initially while using it, you will get beautiful response and you will have a bit of a lighter skin tone after using a steroid. In that case, you will tend to continue and stick on to the same medication because it is rewarding, absolutely. But that will change your skin environment completely. The normal defense, the normal flora will be changed. The active secretions will be going down, changing your skin texture, and the skin will completely become dependable on the steroid. After withdrawing the steroid, you will have they may have to encounter a lot of side effects after that. Sometimes, while using the steroid, also after a few weeks, they may have to be challenging complications will be there. So that's one of the very difficult things, because after withdrawing the steroid, it will show up immediately within 2 3 days after stopping the steroid. So it's very difficult to treat that case. So here I would still say don't use over-the-counter medications, not only steroid. So people tend to use common ingredients, common actives, what they are hearing from their closer sources like friends or whoever
Mm,
nearby, like vitamin C,
right.
vitamin E application. So that a skincare routine itself, I would suggest, it is not common for everyone, not common for
Mm,
every skin. Even if it is a dry skin, I mean, two people of the same kind of type of skin need not have the same skincare routine. The skincare routine should be a tailor-made thing. So whatever suits you may not suit everyone else. So
mm,
go
right.
consult a qualified dermatologist to know the type of your skin, then test a few actives on your skin, and then go for the skincare routine. That applies absolutely for acne management. So even with
Right.
active acne also, not everyone will work with glycolic acid, not everyone will go well with salicylic acid. So it has to be a uh, prescribed medication when you're going with it, when you're treating for acne.
Right, because we all are different. All our skins are different. The reason for acne, etc., could be different. So it's important to have an individualistic, treatment approach. And for that, we need to go and consult a qualified doctor. Because otherwise, if we keep on experimenting with these over-the-counter medication or home remedies, DIYs, then we'll end up having other side effects. So it's important to go to the right person at the right time. So as soon as you start spotting these acne, please go and consult with a qualified dermat. As you said, a good skincare routine is essential, but then again, it's tailor made. But still, as a generalized statement, if you can tell us what are the basics to go for? I mean, because as a layman, we know that washing our face is important, applying something on our face to moisturize it is important. Then sun protection, photogenic, that protection is also important. But then as a person who has a oily skin or who is acne prone, we are so concerned with what to use, what not to use. So, what could be a basic minimalistic skincare regimen, doctor?
Yeah, like most of us know the skincare routine, like you are well versed. We have told the all the CTM. It's cleansing, toning, moisturizing. I would definitely add photo protection here, because
Hmm.
photo protection has become a must and it has become a routine skincare right now. So cleansing is very important, particularly in acne prone skin. They'll tend to lack that good the removal of the dead cells or the excess oil is what is very important for them. So good cleansing is very important, but that need not be very aggressive. So if I'm having recurrent episodes of acne, I need not have cleansing with oil-free or some kind of cleanser that will remove excess oil, and I need not use it for 4 times, 5 times. No, it should be a gentle cleansing even in case
But
of an acne
a
prone
very
skin.
common tendency that people have, especially those who have oily skin, they feel that it's because of the excessive oil
Excess
secretion,
oil.
and thus they feel that the number of times they'll wash their face, the more acne-free, oil-free their skin will be. So you are telling this is again a myth.
Exactly, because
Oh,
the
okay.
people are so obsessed about removing the excess oil. So they are looking for
Right.
products which will literally pull out the oil from your skin. No,
True.
it is not. Because the oil is a defense in your skin. It will protect your skin. It gives a good barrier mechanism for your skin. It is antibacterial, it is antifungal, and it gives us a smooth texture. And those who have oily skin have youthful skin. So they age very late. The aging is very delayed for
True.
people with oily skin. So it's a blessing. And people who are obsessed with having excess oil or oily skin, please be happy that you have a very good skin. So the first in cleansing method, don't think that your first target should be removing the excess oil. It need not be. It should be a good cleansing and a gentle cleansing. So that's one thing, and no need to wash your face excessively or aggressively. No need to use a bleach or scrub very often. It can be done, but need not be very often. So keep in mind, when you are treating acne or when you are in the initial stages of acne or even in the maintenance phase, gentle cleansing is very important. Second thing is moisturizing when you are specifically in the treatment phase. So when I'm taking any medication that will specifically in case of retinoids or antibiotics, the supplements should be a moisturizing ingredient, because retinoids in specifically target reducing the oil secretion as well as clearing of the excessive ingredients that will clog your pores. In that case, the skin barrier can be a little impaired and it will cause drying. In that case, moisturizing helps really a lot in managing acne and specifically during acne. In selecting a moisturizer, do look for non-occlusive moisturizers or non-greasy applications, because something in the formulation of a gel or lotion or serums will help you a lot. Try to avoid ointments or thicker formulations that might clog the pores. So, if I see any ingredient that will give me a clue like vegetable oil or mineral oil, better to avoid that kind of moisturizer. So,
Okay.
moisturizer is a very good supplement or a supporting product in an acne skin, and particularly during acne management. But
Mhm.
in our kind of setup or our kind of environment where there's a lot of humidity, it need not be a must. So during maintenance phase, you can go for it. So if I'm going in for a serum, I can skip a moisturizer. And if I'm not
Okay.
taking a active management, if I'm taking an active management for acne in that phase, it is definitely up to the subject to decide on using a moisturizer or no. And then
Right.
very important is the treatment part, which we generally recommended as topical antibiotics and topical retinoids. And
Right.
the last but not the least is photoprotection. Photoprotection is very important in acne because even if you stay indoors, we are like among the artificial lights exposure. And most of us tend to go out in sun at least for a few minutes. During acne treatment, it is very important to use a photoprotection, good sunscreen that need not be having a high SPF like 100 or 110, no need. A minimal SPF like SPF 30 or 50 would do. So these cleansing, gentle cleansing, very important. Moisturizing, apart from using actives, photo protection is very, very important during acne management as well as in maintenance phase.
Right. So, but then with sunscreens, people have so many reservations. Like, why should I use a sunscreen when I'm not going out? And why to layer up my acne with these sunscreen? And then they don't find the texture of the sunscreen suitable. So, is it equally advisable to go and consult with a dermat to choose the right kind of sunscreens, because market is again flooded with such products.
Absolutely, yes. Because a dermatologist can suggest you the formulation that will suit you better. The skin friendly, pH friendly is very important. And there are sunscreens that are categorized according to the need, like acne for oily skin, acne prone skin, or dry skin, or like the texture of the sunscreen has changed, and someone who gets moves out and gets encountered with a lot of pollutions, anti-pollution ingredients are there. So for acne prone skin, look for something that is lighter, feels lighter, that is easily spreadable, and sometimes lotion formulations are there. I would suggest not to use a spray over the face because of the aerosols you may get inhaled. And usually, the spray formulations have a little bit of irritation component, so I usually don't suggest spray sunscreen over the face. But lotions and gel formulations work really good. And you can use a physical sunscreen because it will not chemically react with your skin, and it will kind of stay inert. So after a little bit of cleansing and moisturizing, definitely a physical sunscreen can be applied. Nowadays we have a
Especially for
lot.
those who have sensitive skin, doctor.
Yes, yes. Because people who have sensitive skin also, you have very lighter components, and physical sunscreen works so good in sensitive skin. And for those also, use a moisturizer, and then on top you can use a sunscreen.
Now we'll talk about the treatment options available, but before that, there is a question by Praveen Sharma. His question is how to cure body acne. It's big in size. Please tell how to prevent.
And body acne is one of the common conditions. Some people will present with face acne as well as body acne. Some will have a very clear facial skin, but they will present only with the chest and body acne. Truncal acne, in that case, the ingredients have to be a little bit uh, different. Treatment has to be a little bit different, and the strength of the medications what we are giving will be a little more powerful than what we are using over the facial skin. In that case, we'll give if we see there are bit of infection, signs of infection, we'll give systemic antibiotics in the form of tablets or gel or sprays. And topical retinoids help a lot in body acne. So if the lumps are very big, there could be some infection or pus collection. So in that case, tablet forms helps a lot. Apart from that, we have acne medications, soaps are available, sprays are available. Here also similar, like need not do a lot of cleansing, but one or two mild cleansing will help. And topical retinoids help a lot in body acne. One more important thing is there are a lot of fungal infections present these days. So people tend to use over-the-counter medication combination of steroid and antifungal. When people are using steroid, even in any other part of the body, your body will tend to have kind of acneiform eruptions which look very similar to acne. And this acneiform eruption also is common over the body, chest and back. So in that case also you have to, obviously a qualified dermatologist only can differentiate that. In that
So
case, go
Praveen,
consult someone and find out the cause for the body acne.
right. So Praveen, you need to go and consult a qualified dermatologist and find the right cause and get it treated. And doctor, now talking about the treatment options available for acne. What are they?
Depends on the type of acne. Initially, if they are presenting with minimal inflammation, just comedons, minimal pustules, the treatment is very rewarding. Topical antibiotics like clindamycin is there, benzoyl peroxide is there, minocycline, erythromycin. We have a lot of formulations these days. Commonly used are benzoyl peroxide, in 2.5 to 5%. Like more than that, you have to be very cautious while using benzoyl peroxide more than 5% because it is very irritating, and also it will cause kind of bleaching in your skin. So the hairy part has to be treated cautiously. Clindamycin topical formulations in gels, sprays, lotions, um, beautiful, rewarding formulations are there. Apart from that, if there is no signs of infection, only inflammation, and it is associated with pigmentation, we will go for categories of topical retinoids. Topical retinoids like adapalene is there, tazarotene is there, tretinoin is there. Tretinoin is also there in different strengths that are the minimal irritation side effect part is there, but it is giving a very good clinical outcome.
Mm.
Then, if the grade goes severe, will apart from the topical formulations, we'll consider giving antibiotics tablets or
Mm.
oral formulation capsules. We consider giving an antibiotic for a shorter course of time, and systemic retinoids are there. Systemic retinoids are absolutely beautiful results are there, but that also has to be supplemented or supported with moisturizer and sunscreens.
Right. Now, but what about those marks and scars, those pits? How do you treat them?
Marks in the form of pigmentation, it's
Mm.
kind of easy to treat. But when you are presenting with acne like bumps, pimples, pustules, and along with that darker patches or darker spots like brown and black spots are there, don't jump into treating that mark first, because here you have to go for the active part first. Focus on the active part, get rid of the infection and inflammation first. So focus on the active acne, get treated with that acne, and slow down the cropping up or triggering that something is triggering. So focus on that and get rid of that. See, the active acne has to be treated first, then focus on the marks. Because initially itself treating and focusing on the marks can trouble us with then and there cropping up of active acne and triggering of the inflammatory part. So I would definitely suggest treating the active acne with some retinoids or other actives, and then focus on the marks. For the marks, we have umpteen number of formulations like glycolic acid, salicylic acid, azelaic acid. So, retinoids, these formulations in monotherapy or in combination works absolutely beautiful. So, if I see a lot of pigmentation and very few active acne, I would be thinking of azelaic acid. Very minimal pigmentation, but a lot of active uh, papules and
Activation.
pustules, I'll think of retinoids or glycolic acid combinations, lactic acid. A lot of combinations can be done. But we have to stop the developing of new acne or progression of the underlying lesion first. Once the active acne is controlled, then we can very well focus on the pigmentation part with the ingredients like kojic acid, AHA, BHA combinations, salicylic acid, glycolic combinations. Along with that, photoprotection should be a must here.
Right. One more question by Vijayaraghvan. Does stress cause acne?
Absolutely. Beautiful question. Yes, because it's not only teens these days are presenting with acne. It's not a hormonal cause. It's not just the acne because of cosmetics or something. There are a lot of conditions. One among this is stress. Stress might definitely cause cropping up of acne or triggering of acne. We can very well see even in school or college kids these days, uh, when they are very stressed, the acne will be like cropping so much. But when they are following a very good diet and they are stress free and they're relaxing and they're not very stressed, the response will be more, and triggering of acne will be also less. Stress
Right.
has got so much of relationship with acne.
And after talking about diet, as you said, a healthy diet is important, but then what to eat, what not to eat? Are there any myths associated with the, dietary thing also in relation to
Yes,
acne?
yeah. Because exactly one thing that everyone will ask you with a skin doctor is diet, and particularly with acne, they will ask for diet suggestions. Uh, Diet to some extent is definitely related with acne, but unlike everyone is commonly saying, like, if I take oily food, if I take junk, and then too much of non-veg, will it get worse? So it's not always oily food, not always non-vegetarian food. There are very limited restriction that has to be done, if at all. Okay, and again, this is not for everyone. These are for specific conditions. In common, diets commonly associated with triggering of acne are high glycemic index food like breads, sugars, sweets, like uh, simple sugars, pastries, all are those food which are in high glycemic index are associated with acne triggering, and milk, and sometimes milk products are like if one is taking too much of milk products, particularly cow's milk, there will be aggravation of acne. And very rarely oily foods, but I wouldn't directly say it is oily foods. Like too much of junk also can induce acne. Apart from that, the nothing to be avoided too much. If you are take like someone who is very focused on a lot of protein intake, then look on to your hydration part. So directly, you don't have to completely stop taking milk and stop taking dairy products. It's like I would say, this depending on the activity of your acne. If it is too much aggravating, try to cut down. And what I would suggest to add more into your diet is more of green leafy vegetables, more of fibers, vitamin C rich food, particularly fruits and raw veggies, um, sprouts, and those food rich in antioxidant helps a lot in acne healing. Specifically, that's my very favorite suggestion is go for colored veggies and fruits that have a lot of antioxidants and a lot of beta carotenes that will help you in healing the acne.
Okay. And Doctor, before we sum up the whole session, any take-home message for our viewers?
Oh yeah. So do follow a skincare routine. When it comes to acne, don't jump into going in for many actives together. So when you are going having encountering a few cropping up of episodes of acne, do consult a dermatologist so that you can find out what is causing or what is triggering your acne. That's the one thing. So identify the cause and treat the cause. And once you get treated, then follow a maintenance regime that will reduce the triggering episodes of cropping of the acne. And when people get more acne, they will immediately jump into applying vitamin C serum, niacinamide serum, salicylic acid face wash. No, it need not be done all of a sudden. When you are introducing few actives in your skincare regimen, go for each and every product one by one. Give it some time. If I'm adding a salicylic acid face wash, then give some time when before adding a next active. That's one thing. So today morning also I was one patient was asking, like, I've been spending so much and using so much of skincare routine, but still I'm getting acne. I told her, like, did you identify what is your cause? I asked her, like, what are the things you are not doing? What are the things you are doing too much? So just don't look out to the skin problem or skin challenge from the outside. Look from the inside. So when you are
Yeah.
healthy from the inside, your skin will also be healthy. Think about hydrating. Are you really drinking water, adequate amount of water? Are you really sweating out a lot? Are you doing some kind of a physical workout? Think of all
Hmm.
these things. Healthy habits will give you a healthy skin. So if I'm having a very sedentary lifestyle, I'm not taking anything healthy inside, and still I would like to have a very glowing skin, it's very difficult. So
Right.
doing a skincare routine alone will not give you a great skin. Do healthy habits, sleep well, have proper diet, have it on time, do some kind of a physical workout. Apart from these, definitely do a skincare routine. It will help you a lot. Also, specifically in cases of acne, don't jump into going in for over the counter medications or something that will clear your dirt, excessive oil, all those. Properly follow an active management protocol. Once you get rid of or once you find a good clinical outcome, then go in for a maintenance regime and don't go for episodic treatment for management, and then you get a good remission, then follow maintenance regime, then go in for skincare routine. That will help you a lot and lot in the long run.
Thank you so very much, Dr. Divya. It was wonderful talking to you. Thank you for making us so informed and aware about acne management now. Thank you so very much for your
Thank you
valuable
so
time.
much. Thank you. Thank you so much for all the participants and particularly to you to help all of us understand what is acne, because I'm really concerned about the myths about acne. So when you know a lot of facts, what is really there, then the
Hmm.
management part becomes easy. So thanks all for the
Absolutely.
participants.
Completely agree with you. Thank you so very much, Dr. Divya. And viewers, thank you for your active participation. Stay happy, stay healthy, stay spotless, and take good care of yourself.
Thank you.
Have a good evening ahead.